Guys, first let's take a look at what's the chaos that's been going on around us.
As Karnataka's Hassan district is grappling with an alarming surge in heart
Link
attack
between these
with
deaths
diabetes,
and
Health
COVID
Minister
vaccines.
Dinesh
His
Gundulao,
government
while
has also
speaking
said
to
a
CNN
committee
News 18,
of
has said
experts
that
to
the
identify
government
the
has
exact
formed
cause.
24
Fine, now take a deep breath and calm down. I'm Dr. Rohan, and let me guide you through all the chaos that's been going on around with the recent matter about the cardiovascular deaths that's been occurring around in Karnataka. Guys, let me start with the basics first. So what is heart? Heart is a type of muscle just like in any other part of the body, but it has a special function of contractility and rhythmicity which it gets from the electrical pathway that passes through the heart. Heart's main function is to pump blood to the body, but to do so, it also needs blood which it gets provided through the coronary blood vessels. Heart has many different pathologies and abnormalities, but our main concern here is improper blood supply to the heart and improper electrical rhythm in the heart. So let's take a deeper look into improper blood supply to the heart. In older age people, the blood vessels get clogged mainly because of two reasons. One is due to heart particles, that is atheroma, or which we commonly call as atherosclerosis, or due to thrombus or emboli. Due to the clogging of blood vessels, what happens is, so the muscle tissue it gets denied of blood and oxygen, which can eventually lead to cardiac tissue death or necrosis or infarction, which we commonly call as heart attack. So that was the case in old age people, but in young age people, even though they are at a risk of developing thrombus, emboli or fat particle or atheroma, there are additional other causes which can cause the heart attack in young age people. So let us take a look into what are those causes. One of them is hypertrophic obstructive cardiomyopathy, fat embolism, or Takotsubo cardiomyopathy. What is hypertrophic obstructive cardiomyopathy, or HOCM, which we commonly call it? HOCM is where the heart muscle size gets increased or hypertrophied, leading to blockade of the aortic opening and eventually decreasing the blood supply through the coronaries and leading to cardiac tissue death. This mainly occurs in young age people and athletes because to meet the oxygen demand of the body tissue or due to genetics, the heart muscle cell increases their size, causing the aorta to get blocked and leading to sudden cardiac death. So let us take a deeper look into another cause, that is Takotsubo cardiomyopathy. It is a similar cause just like HOCM, but here the heart muscles get weakened due to either emotional stress, physical stress, or day-to-day ongoing other stresses or mental illnesses, which causes the heart muscles to get weakened, leading to improper pumping of the heart and improper blood supply to the heart itself, which can eventually lead to cardiac tissue death and mimicking myocardial infarction. Fat embolism, which occurs mainly due to the fracture of long bones, where the bone marrow or the marrow material get dislodged, causing the clogging of coronary blood vessels and eventually leading to cardiac death due to the improper blood supply to the heart. This occurs mainly in young athletes and the persons who are more prone to road traffic accidents, where the long bones are easily getting fractured. Now that we know what happens due to improper blood supply to the heart, now let us discuss what happens if there is improper electrical rhythm in the heart. Arrhythmias are very common in young athletes because of the sudden changes in the heart function to meet their athletic needs and very high intensity trainings. The sudden transition from sedentary lifestyle to a very high intensity trainings without proper trainers. It can also occur due to genetic conditions like WPW syndrome. So you all mainly tuned in for this part of the video, right? So the answer for your question is both yes and a no. Yes, the COVID infection or the people who have previously got infected with the COVID itself are at a moderate risk of developing thrombus or emboli and causing the cardiac pathologies. As suggested in the recent studies about the post-infectious complications of COVID-19, it is clear that the virus itself forms the proteins which can form thrombus or emboli and get clogged in the coronary vessels, leading to myocardial infection and eventually cardiac death or the sudden death. And the other answer is no. The COVID vaccine itself doesn't cause any cardiac death or cardiac abnormalities according to the recent studies done by both the organizations, that is government organization, that is ICMR, and the pharmaceutical organizations of the private companies. So with all the chaos that's been going around all around the world regarding the death in engaged people and very athletic and bodybuilders, etc., all this can be prevented just by doing some preventive measures. And those preventive measures are lifestyle modification, working with well-trained athletes instead of unprofessionals, getting checked with a physician before beginning any form of physical training, fasting and proper diet after consulting a nutritionist. Lastly, get a regular general checkup or investigations every 6 months to 1 year. And people, even if after applying all these preventive measures, if someone is having a cardiac attack or myocardial infarction, we can prevent cardiac deaths with just by knowing cardiopulmonary resuscitation. And you can also help by contacting the tertiary care centers, immediately transferring the patient to bigger hospitals where the death can be easily prevented. The life-saving component, that is CPR or cardiopulmonary resuscitation, is a topic for another day where I'll tell you how to do basics of CPR, which is very life-saving. Thank you.